Adrenal glands, functions, and hormones. Overview. The adrenal glands are paired endocrine glands located on top of each kidney. Each adrenal gland has two distinct parts with different functions and hormones. 1. Adrenal cortex, outer layer, produces steroid hormones. 2. Adrenal medulla, inner layer, produces catecholamines. Hormones of the adrenal glands. 1. Adrenal cortex, divided into 3 zones, each producing specific hormones. Zone, mormone hormone. Function. Divinal glomerulosa, zona glomerulosa, mineralocorticoids, aldosterone. Regulates NA-pi and K-pi's balance. Maintains blood pressure by controlling fluid volume. Zona fasciculata, glucocorticoids, cortisol, regulates metabolism. Helps the body respond to stress. Has anti-inflammatory effects. Zona reticularis, gonadocorticoids, androgens, e.g. DHEA, supplement sex hormones, influence puberty and libido, especially in females. 2. Adrenal medulla, composed of chromaffin cells, part of the sympathetic nervous system. Hormones, function. Epinephrine, adrenaline. Increases heart rate, blood pressure. Blood glucose. Prepares body for fight or flight. Norepinephrine, noradrenaline, constricts blood vessels. Increases BP and supports alertness. Functions of the adrenal glands. Function, hormone involved. Regulating blood pressure and electrolytes, aldosterone, stress response, physical, emotional, cortisol, epinephrine, anti-inflammatory and immune modulation. Cortisol, energy metabolism, glucose, fat, protein. Cortisol, secondary sex characteristics, androgens, fight or flight response. Epinephrine, norepinephrine. Clinical significance, disorder, cause, affecting. Addison's disease, cortisol and aldosterone, weakness, hypotension, weight loss, dark skin. Cushing's syndrome, cortisol, often from tumors or steroids, obesity, moon face, hypertension, diabetes. Pheochromocytoma, tumor of adrenal medulla, overproduction of catecholamines, severe hypertension, hyperaldosteronism, aldosterone, hypertension, low potassium. Summary chart, adrenal region, main function, main fets, cortex, zona glomerulosa, aldosterone, salt and water balance. Cortex, zona fasciculata, cortisol, stress, metabolism, inflammation. Cortex, zona reticularis, androgens. Secondary sex traits, medulla, epinephrine and norepinephrine, fight or flight response. Testes and ovaries, functions and hormones. The testes, male gonads, and ovaries, female gonads, are vital endocrine glands involved in reproduction and secondary sexual characteristics. Both produce gametes, sperm and ova, and secrete important sex hormones under the influence of the hypothalamic pituitary gonadal axis. Testes, location scrotum, outside the male body. Hormones produced. Secreted by function. Influent testosterone, Leydig, interstitial cells. Stimulates sperm production. Develops and maintains male secondary sexual characteristics. Deep voice, facial hair, influences libido and aggression. Inhibin, Sertoli cells. Inhibits FSH secretion to regulate spermatogenesis. Functions of testes. Produce sperm, spermatogenesis. Secrete testosterone. Support male sexual development and function. Regulate feedback to hypothalamus pituitary via inhibin. Ovaries. Pelvic cavity, one on each side of the uterus. Hormones produced. Hormone secreted by function. Estrogen, developing follicles, corpus luteum, develops female secondary sexual characteristics, breast growth, fat distribution, menstruation. Regulates menstrual cycle, endometrial growth, and bone health. Progesterone, corpus luteum, mainly after ovulation, prepares uterus for implantation. Maintains pregnancy. Inhibits uterine contractions. Inhibin granulosa cells. Inhibits FSH to regulate follicular development. Relaxin, corpus luteum and placenta. Relaxes uterine muscles. Softens cervix during labor. Functions of ovaries: produce ova, eggs for fertilization, regulate menstrual and reproductive cycles, secrete estrogen and progesterone, support pregnancy and female sexual development. Regulation by pituitary hormones. Both testes and ovaries are regulated by pituitary hormone, target, function. FSH, follicle stimulating hormone, testes, Sertoli cells, ovaries, follicles, stimulates spermatogenesis in males, stimulates follicle growth and estrogen production in females. LH, luteinizing hormone, testes, Leydig cells. Ovaries, theca, corpus luteum, stimulates testosterone secretion in males, triggers ovulation and progesterone secretion in females. Summary table gonad, hormones. Main functions: testes, testosterone, inhibin, sperm production, male traits, feedback inhibition, ovaries, estrogen, progesterone, inhibin, relaxin, ovum release, menstrual cycle, pregnancy support, female traits. Other hormones, functions and sources. In addition to the major endocrine glands, pituitary, thyroid, adrenal, pancreas, gonads, etc., several other organs and tissues produce hormones that play essential roles in maintaining body homeostasis. These are often non-endocrine organs with secondary endocrine functions. List of other hormones and their functions. Hormone source functions. Melatonin, pineal gland, regulates circadian rhythm and sleep-wake cycle, acts as an antioxidant. Erythropoietin, EPO, kidneys, stimulates red blood cell RBC production in the bone marrow. Renin, kidneys juxtaglomerular cells, regulates blood pressure via the RAS system, renin-angiotensin-aldosterone system. Calcitriol, active vitamin D, kidneys, promotes calcium and phosphate absorption from the intestine. Atrial natriuretic peptide, heart, atria, reduces blood volume and pressure by promoting sodium and water excretion by the kidneys. Brain natriuretic peptide, heart, ventricles, similar function to ANP, used as a marker for heart failure. Thymosin, thymus, promotes T-cell maturation and immune function. Gastrin, stomach, G cells, stimulates secretion of gastric acid, HCl, for digestion. Duodenum, small intestine, stimulates bicarbonate release from the pancreas to neutralize stomach acid. Cholecystokinin, CCK, duodenum, stimulates gallbladder contraction and enzyme release from the pancreas for digestion. Stomach, stimulates hunger appetite, hunger hormone. Leptin, adipose fat tissue, suppresses appetite and regulates energy balance, satiety hormone. Resisting adipose tissue may contribute to insulin resistance and inflammation. Human chorionic gonadotropin, HCG, placenta during pregnancy, maintains corpus luteum and progesterone production during early pregnancy. Human placental lactogen, HPL, placenta, prepares mammary glands for lactation, modifies maternal metabolism during pregnancy. Prostaglandins, various tissues, local signaling molecules involved in inflammation, fever, pain, uterine contractions, and more. Summary chart of other hormones, organ tissues, main function. So, pineal gland, sleep regulation, kidney, EPO, renin, calcitriol, RBC production, BP regulation, calcium metabolism, heart, ANP, BNP, reduced blood pressure and volume, thymus, thymosin, T-cell development, stomach, gastrin, ghrelin, digestion, hunger, small intestine, secretin, CCK, digestion aid, adipose tissue, leptin, resistin, appetite control, metabolism, placenta, HCG, HPL, pregnancy maintenance, body tissues, prostaglandins, local inflammation, labor, vascular tone. Remember, some hormones act locally, paracrine, autocrine, like prostaglandins. Many of these hormones interact with major endocrine systems to maintain homeostasis. Endocrine system hormones and their alterations in disease. The endocrine system maintains homeostasis through precise hormone secretion. Hormonal imbalances, whether deficiency, excess, or resistance, can result in a wide range of diseases or disorders. Here's a comprehensive overview. 1. Pituitary hormones. Hormone, alteration, associated disease. Growth hormone, excess, gigantism in children, acromegaly in adults. Deficiency dwarfism in children, adult GH deficiency, TSH stimulating hormone, secondary hyperthyroidism, secondary hypothyroidism, ATH adrenocorticotropic hormone, Cushing's disease H producing tumor, secondary adrenal insufficiency, FSH-LH, infertility, hypogonadism, prolactin, galactorrhea, amenorrhea, infertility, poor lactation postpartum. 2. Thyroid hormones, T3 tration, disease symptoms, hyperthyroidism, Graves' disease, toxic nodular goiter, weight loss, heat intolerance, tremor, palpitations, hypothyroidism, Hashimoto's thyroiditis, iodine deficiency, fatigue, weight gain, cold intolerance, bradycardia, depression. 3. Parathyroid hormone, PTH, alteration, symptoms. Hyperparathyroidism, primary hyperparathyroidism, often due to adenoma, hypercalcemia, stones, groans, moans. Hypoparathyroidism, often post-thyroid surgery, hypocalcemia, tetany, seizures, muscle cramps. 4. Adrenal hormones, cortisol, glucocorticoid, alteration, symptoms. Cushing's syndrome, central obesity, moon face, purple striae, hypertension. Addison's disease, weight loss, hypotension, hyperpigmentation, fatigue. Aldosterone, Conn syndrome, primary hyperaldosteronism, hypertension, hypokalemia, alkalosis. Salt craving, hypotension, hyperkalemia. Adrenaline, noradrenaline. Pheochromocytoma, episodic hypertension, headache, sweating, palpitations. 5. Pancreatic hormones, hormone, disease symptom. Insulin deficiency, type 1 diabetes mellitus, polyuria, polydipsia, weight loss, DKA. Resistance, type 2 diabetes mellitus, hyperglycemia, fatigue, obesity. Glucagon, excess, rare glucagonoma, hyperglycemia, weight loss, rash, necrolytic migratory erythema. 6. Gonadal hormones, estrogen, progesterone, testosterone. Hormone alteration, symptoms, disease refectomy, estrogen, menopause, ovarian failure, hot flashes, osteoporosis, mood swings, testosterone, hypogonadism, low libido, muscle loss, erectile dysfunction, testosterone tumors, anabolic steroid abuse, hirsutism, acne, aggression. 7. Pineal gland melatonin, alteration, insomnia, circadian rhythm disorders may contribute to seasonal affective disorder. 8. Thymus, thymosin, affect, immunodeficiency in children, e.g. DeGeorge syndrome. 9. Other hormonal alterations. Erythropoietin, EPO, in chronic hypoxia or tumors, polycythemia. In heart failure, diagnostic markers, leptin, resistance, not deficiency, obesity, ghrelin, in fasting, stimulates appetite. Summary chart of hormonal imbalances and disorders. Hormone excess, deficiency, GH, acromegaly, dwarfism, T3, T4, hyperthyroidism, hypothyroidism, PTH, hyperparathyroidism, hypoparathyroidism, cortisol, Cushing's syndrome, Addison's disease, insulin hypoglycemia if oversecreted, diabetes mellitus, estrogen, testosterone, precocious puberty, PCOS, hirsutism, infertility, delayed puberty, melatonin theory, insomnia. Sure. Here's the endocrine system physiology, 15 applications and implications in nursing practice in paragraph form without tables for smoother reading and note-making. Endocrine system, 15 applications and implications in nursing. 1. Monitoring blood glucose levels. Nurses play a crucial role in managing diabetes by monitoring blood glucose levels and administering insulin. Understanding how the pancreas regulates insulin and glucagon is essential for safe and effective care. 2. Administering hormone therapy. Hormone treatments such as insulin, levothyroxine, corticosteroids, or sex hormones require accurate dosage and timing. Nurses must understand their effects, side effects, and patient education needs. 3. Recognizing hormonal imbalances. Symptoms like fatigue, weight changes, mood swings, irregular menstruation, or electrolyte disturbances can point to endocrine disorders. Nurses must assess these early to prevent complications. 4. Thyroid disorder management. Nurses caring for patients with hypothyroidism or hyperthyroidism must monitor symptoms and interpret T3, T4, and TSH lab values to ensure proper medication titration and detect thyroid storm or myxedema. 5. Corticosteroid use and tapering. Long-term steroid use can suppress the adrenal glands. Nurses must watch for signs of Cushing's syndrome, infection, poor wound healing, and manage steroid tapering properly. 6. Fluid and electrolyte balance. Hormones like ADH and aldosterone play key roles in water and sodium regulation. Nurses monitor patients for dehydration, edema, and electrolyte disturbances, particularly in critical care. 7. Patient education and health promotion. Educating patients about managing chronic endocrine conditions like diabetes, thyroid disorders, or PCOS helps improve adherence to medications and lifestyle modifications. 8. Monitoring growth and puberty. In children, growth hormone disorders may cause dwarfism or gigantism. Nurses track developmental milestones and assist in managing pediatric endocrine disorders. 9. Understanding stress and shock responses. During trauma or surgery, cortisol and catecholamines, adrenaline, noradrenaline, surge. Nurses need to anticipate these responses and manage vital signs and glucose accordingly. 10. Reproductive and menstrual health. Nurses often assess for menstrual irregularities, fertility issues, or menopause symptoms, which involve imbalances in estrogen, progesterone, LH, and FSH. 11. Postoperative endocrine care. After thyroid or adrenal gland surgery, nurses monitor for complications like hypocalcemia due to parathyroid damage, adrenal crisis, or thyroid storm, which can be life-threatening. 12. Detecting and managing SIADH and diabetes insipidus. Both conditions affect ADH regulation. Nurses must recognize signs of fluid overload in SIADH or dehydration and excessive urination in diabetes insipidus. 13. Psychological and behavioral assessment. Mental health changes such as depression, anxiety, or cognitive dullness may be caused by hormonal imbalances, especially thyroid or adrenal hormones, and nurses must be vigilant in recognizing them. 14. Safe medication practices. Nurses must be aware of medications that affect endocrine function, like lithium, affects thyroid, or diuretics, influence aldosterone and electrolyte balance, to avoid adverse effects. 15. Maternal and neonatal care. During pregnancy and lactation, hormonal changes affect the mother and baby. Nurses provide care based on changes in HCG, prolactin, progesterone, and support lactation through knowledge of breastfeeding hormones. Conclusion. Understanding endocrine physiology helps nurses recognize critical signs, administer treatments safely, educate patients, and monitor complex hormonal interactions. Whether in general wards, ICUs, pediatrics, or maternity, endocrine knowledge enhances holistic and responsive nursing care. Thank you. Have a nice day.